Hi everyone, my name is Dr. Janjil. I'm an incoming pediatric resident, and this is part 2 of my series, questions that I got incorrect during my pediatric elective. The first question I got incorrect was regarding hand, foot, and mouth disease. Hand, foot, and mouth disease is a viral infection that is caused by Coxsackie A virus. The mid-level asked me what is a complication of hand, foot, and mouth disease, and I said myocarditis. That's what I said. That was the first thing that came to my mind, and that is incorrect. Coxsackie A and there's Coxsackie B. You have to remember that Coxsackie B causes myocarditis. Severe complication for Coxsackie A would be aseptic meningitis and onychomatosis, which is nail shedding. Okay, the next question I got incorrect. A patient, he was 1 year old. He came in with fever, diarrhea, and abdominal pain. The first thing that I thought, I asked the mom about any new food, blood in the stool. She told me no. I was thinking, okay, maybe this is just an acute viral infection causing gastroenteritis. I presented my findings to the attending. He asked me, what is the difference between gastroenteritis and teething syndrome? I told him I would look it up. Teething syndrome, because of the excess drooling, that causes excess saliva, and due to the excess saliva and the patient is swallowing that, it can cause gastric irritation and potentially cause loose stools. But there is mixed data regarding if teething syndrome should cause diarrhea, but the experienced doctors who have been around for many years have seen a link between teething, drooling, excessive saliva, and diarrhea. The last question I got incorrect was regarding this picture. Attending was conducting his physical examination, and he called all of the medical students and he asked us, what is this diagnosis? The patient stuck out his tongue, and his tongue was literally just like this. He could not come up with a diagnosis. If you know what this is, put it down in the chat. And this is called a benign migratory glossitis or a geographical tongue. And it's painless, sometimes mildly painful, and the treatment is usually none, but if they do have pain, you can give them antihistamines or Tylenol to reduce the pain. That wraps up part 2 of the questions I got wrong during my pediatric elective. Thank you guys for tuning in. If you learned something new, please drop it down in the chat. Bye for now.